community outreach and population health improvement projects for the hospital, and also some of the internal quality improvement stuff as well. I'm here to talk about our community service plan. So a lot of this actually builds off of Stacy's presentation from our last meeting, where she discussed the county's community health assessment and community health improvement plan. For the Department of Health and also the IRS, hospitals have to complete a community service plan every 3 years. So this will be our first one since 2019. And obviously, as everybody here knows, a lot has changed since 2019. So this was a pretty fun one to work through and look at what has changed for our population and also for the work that we've been doing. The State Department of Health, really encourages participation between the hospitals and their local health departments. So when we completed this, we worked with the Mid-Hudson Public Health Collaborative, which is a group of 7 health departments, Ulster included, and then a bunch of the ones surrounding. And also the Ulster County Prevention Agenda Leadership Team, which again, Stacy talked about a little bit last time. So this is a map of where the hospital is located. And so we do stretch outside of Ulster, where service area is kind of like this. We get a little bit of Sullivan and a little bit of Orange. So some of our demographics look a little bit different, but primarily we do serve mostly Ulster County. You can see how large the difference is between 12428, which is the Ellenville zip code, and all of the rest of them. These are our top 10 zip codes. Most of them are Ulster. I think 2 or 3 Orange, and then the rest are Sullivan County zip codes. Actually, I wanted to note for this too. So the percentage of total from these 10 zip codes is 11,600 unique patients who made about 28,000 visits in 2021. Our ED typically sees about 14,000 visits. So it's really about half of our work is the emergency department. The other half is, like I mentioned, those outpatient services that we offer as well. As the Rural Health Network, we are tasked with trying to improve the health of the Wawarsing area. And one of the ways that we look at that is trying to make all of Ulster County a little bit more equitable. And you can see the differences in population and some of the outcomes. I didn't throw too much health outcome data in here, but I wanted to give a general overview of the population we work with. You can see compared to Ulster County, we are less white. Much higher rates of Hispanic population. We're about on par with percentage of seniors, but I wanted to throw that in there because that's one of the main populations we work with at the network. And you can see the big difference in median income, as well as the percent of people that are living below the poverty line. So to the community service plan, we are required to have public participation, which we got through the Siena Research College survey that they did as part of the Mid-Hudson Region Community Health Assessment. There was 647 responses to that survey in Ulster County. It was a random digit dialing survey that they did. 313 were in our service area, but again, that's those 10 zip codes which stretch outside of Ulster County. So some of our responses were from Sullivan and Orange. And then as part of the network, we also do constant community surveying about our programs, about the issues that we're seeing. And at the time of this assessment, we had happened to just do one focused on families with children in the home and also one on seniors, which helped us cover a pretty large demographic. We then continued to meet with the Ulster County Prevention Agenda Leadership Team, of which I think a lot of the people on this call were a part of as well, to decide the priority areas for Ulster County. So the ones that Ulster County selected were the ones that we also selected as a hospital, because we feel that keeping what we're working at in line with the agenda of Ulster County as a whole will help us and everybody else also be much more successful. So those were prevent chronic disease and promote well-being and prevent mental and substance use disorders. Getting into the interventions that we laid out for our service plan. Our first focus area, as I mentioned, was promote well-being and prevent mental and substance use disorders. We were in focus area 2, which is mental and substance use disorder prevention. Goals 2.1 and 2.2, those are to prevent underage drinking and excessive alcohol consumption by adults, and also prevent opioid overdose deaths. Our 3 goals for this area were to continue to implement our Project RESCU program, increase community and provider access to harm reduction resources, and then continue to participate in the Ulster County High-Risk Mitigation Team, and also assist with any other efforts in our area that focus on law enforcement assisted diversion. Our Project Rescue program was started in 2019, and this is really a hospital-centric program as opposed to some of the community outreach that I'll talk about in a little bit. It allows for 24/7 inductions onto medications for opioid use disorder with warm handoffs to either a peer advocate or a care navigator. We're able to induct people on MOUD if they come in post-overdose or if they present to our emergency department in active withdrawal. We work with Catholic Charities of OSU to provide access to peer advocates for those patients. We're able to call them in real time if they're here in our ED and want to speak with a peer, and then those peers are able to follow up with them, create care plans, and continue to help them through treatment. If somebody doesn't need as intensive treatment, maybe they are further along in their journey of recovery, but they're to the points of maintaining themselves on MOUD, we do connect them with care navigators right next door at the Institute. So it's just one example of how I said sharing campus with them helps make sure our handoffs are really warm. So we're able to work with them to maintain that. We also have an in-house community health worker who can assist with treatment navigation or social service navigation. That's been really successful for us because we actually have really a disappointingly low number of people who come to our emergency department and are wanting to be moved into and through treatment. Most of what we see is people that are looking for help with navigating the social service landscape, which our wonderful community health worker, Danielle, who some of you might know, is able to do for them, whether it's helping them find transportation, better understand some of the forms they might have to fill out for social services, any of that kind of stuff. This is also helpful because just like every other healthcare facility in the country, we are seeing some staffing shortages. So being able to have somebody else who's available to do that kind of really deep talk and really help with the navigation of our patients and take that off the plate of some of the nurses in our ED has been helpful both for the patients and for us as an organization. Second goal is to increase community and provider access to harm reduction resources. We here at the hospital, it honestly goes back to Project Rescue. And like I mentioned, a very low percentage of people in our ED that were willing to be moved to treatment, especially following an overdose. So we kind of shifted to a much more prevention focused mindset. We do have naloxone. We are an opioid overdose prevention provider, or an OPP. We have medication lock bags, which is what's pictured here. Fentanyl test strips. We offer safer use kits, and we also have recurring events to collect sharps and medication. We actually have just ordered some new lock bags. They look a little different than this. I want to shout out to the Opioid Strategic Action Team's communications group for helping us design them. And I want to make sure to emphasize that we emphasized in this plan increased community and provider access to harm reduction resources. We do have a fairly low patient population that we really work closely with that are actively using drugs. We kind of deal with just about everyone in Ellenville, but it's not a huge amount. So all of this stuff is available to any other provider in our area that might be interested in it. Like I said, we just ordered some new lock bags. I'll have a lot of them. Those are for storing medication. They can be for storing any drug paraphernalia. And especially now with the legalization of marijuana, I think there is a lot of uses for a bag that can lock up your stuff. Finally, continue to participate in the high-risk mitigation team and other law enforcement assisted diversion efforts. We do send representatives to the county's high-risk mitigation team meeting, which is maintained by the sheriff's office. If you don't know about the HRMT, it's a care coordination model that kind of models itself after the single point of access team, where a bunch of really diverse group of providers are able to get together in case conference on shared clients to make sure that nobody falls through the cracks, if you will. And then another thing that we try to do by doing this and making sure that we have a close relationship with law enforcement and also are making that close relationship visible in public is to try to foster a culture where people aren't afraid to call 911 if they do need help with an SUD or with an overdose. And that's important to us because over the past couple of years, we have seen a noted decrease in the number of people who come to our ED either via EMS or driven in by law enforcement. You can watch from 2018 on as the numbers sort of tick down, where everybody that had an overdose came in via ambulance or was brought in by a police officer. And it starts to shift to people coming in their personal vehicles. And lately, even though we know due to the medical examiner data and law enforcement data that overdoses are not dropping, but we're seeing a lot less people come to our ED at all post-overdose. So there's a lot of outreach and education about the Good Samaritan law. We try to make sure that people understand that we have a good relationship with the police, If they have an interaction with the police, they're very likely to be rerouted or diverted into the hands of a substance use professional, whether it's us or any of the many other agencies in Ulster County that do that work. Our next project is a much newer project. Our opiate stuff we have been working on for quite a while, but this one is a little bit new. It's a new project that we're doing in collaboration with the Institute for Family Health, focused on preventive care and management with the goal of increasing cancer screening rates. That's the state's goal 4.1. Our 3 goals are increase cancer screening rates in our service area, increase access to cancer prevention resources and education, and increase access to tobacco cessation services. This is really the largest part of this project, is to increase the cancer screening rates in our area. We've hired a new community health worker who's solely dedicated to helping eligible individuals complete their screening appointments. We're focused right now on mammograms, colonoscopies, cervical cancer screenings, and low-dose computed tomography scans, which are for lung cancer. So ideally, what we would like is 100% of the people eligible. So if we're talking LDCTs, that's anybody who has been smoking a pack a day for 20 years, or the formula of that. Anybody who's eligible is receiving these screening appointments. So we're looking through our patient database, checking in on anybody who's newly become eligible or anybody who has been receiving these screenings and are now newly due. The community health worker is able to reach out to people and help them with maybe public insurance enrollment, maybe understanding the transportation options that are available to them, and then also doing a lot of one-on-one outreach to help give them information and education about the importance of receiving your preventive cancer screenings, about how much more successful your treatment can be if cancer is caught early, and also just some general information to try and ease anxieties about coming to the hospital and receiving these screenings. I think the anxieties about COVID and coming to a hospital have died down a little bit, but getting a new screening or having a new procedure done can still be pretty anxiety inducing. So having somebody who's able to talk it through with you in really layman's terms has been helpful for our patients. I should note also that in addition to the community health worker, there is a exact counterpart at the Institute for Family Health who is a care navigator who's dedicated to doing the exact same thing, but with their patient population. So we're hoping that through the people that receive primary care at the Institute and any other patients who come here for outpatient, we're able to really increase the rates of our area of people completing these screening appointments. Second part of that project is to increase the access to information and education. So along with that one-on-one education and information sharing that the community health worker is doing, they're here on site all the time, available for people to call down to ask for help with navigating resources. Even though that she is dedicated to helping our cancer screening project, we have a lot of people who call who need navigation for any other kind of resource as well. And so we try to make our community health workers available for any of that. This community health worker will also be available for health coaching. So our hope there is that if we do have a new patient who comes in to receive one of these preventive screenings, they will start to work with the community health worker, doing some health coaching, setting some really basic goals, and start to get a lot more comfortable with them and be able to be more open to coming and receiving more of their preventive screenings or reaching out to us when they do need help with any of this kind of stuff. The community health worker also attends community events in our area to provide resources and education, and that's the Blueberry Festival here in Ellenville, the school health fair at the school, to let people know about the importance of getting screened again. And then also we're trying to increase the availability of those community-based events. So we host a number of education events, a lot of them in partnership with some of the people on this call, but we're working to try and up the number of those and up those that are focused on prevention. So we're hoping that combining all of this will kind of help us as a hospital be able to address all of the 3 levels of care, whether it's primary, secondary, or tertiary care as well. We also have a nutritionist on staff who's available to anyone in our community to do one-on-one consultations and host group and community classes. And we actually just hired a new physical health educator who's able to host free physical education classes to the community as well. All of the stuff that we do, I should mention, is completely free and open to anybody in the community that's interested. Even if they're not eligible for any of our cancer screening, we have a community health worker who can do some basic health coaching with them, a nutritionist who can meet with them. We also have another community health worker who does have a focus on families and children that does a lot of the same stuff. The last side of that is to increase the access to tobacco cessation services. So our community health worker and the Institute's care navigator are trained as freedom from smoking facilitators, and our physical health educator, who we just hired, happens to be a facilitator as well. So we are hoping to be able to start up some group sessions if we see enough of an interest in people that want to come to a group. But we're also hoping that the skills that these staff have learned from going through that facilitator training will be able to translate into helping people one-on-one if part of their health coaching is to set a goal to try and cut back or completely cut out their tobacco use. And then lastly, kind of going along a lot of the same stuff, our community health worker is out in the community at these events trying to provide education on the dangers of tobacco use, giving out whatever educational resources we can, and also trying to be there to answer questions. Once again, we try to be as present in the community as we can, handing out this kind of stuff, giving out information, trying to give some education on it. So that people get comfortable with our department, get comfortable with our community health worker. And if they do have a question about any of these cancer prevention screenings or really any other preventive care that they could do, they feel that we're a trusted contact to be able to call. So I threw in my own contact, and then also my two program coordinators are on this slide as well. Samantha is in charge of our chronic disease and wellness stuff, and Marissa's in charge of our substance use stuff. So they can be reached out to for anything specific. All of these programs are open for further collaboration and development. Like I've said 5 or 6 times now, we work with a lot of the people already on this call, but we're very willing to try and further those collaborations and open this program up to a wider audience. And then I did throw in, because Melinda said that these would be shared after this presentation, so a couple of links that I hope are helpful. That Freedom from Smoking program, our community service plan. I believe Stacy already shared these, but the Mid-Hudson Region Community Health Assessment and the county's Community Health Improvement Plan. And then I also threw in a link for the State Department's of Health Prevention Agenda, in case anybody was interested in looking at what some of the other goals the Department of Health has set and what the other focus or topic areas also are.
That's great. Thank you so much, Brandon. I know that we already have a few questions in the chat, and I'm reminding everyone, if you have questions, please type them in the chat. One is from Sue Lennon. Would the community health worker be the person doing the tobacco cessation? Yes.
So like I said, we're going to use the community health worker as well as our physical health educator and the care navigator to host those group sessions. If we see an interest, we're kind of reaching out to people now. Per the American Lung Association, we have to have at least 6 participants to host those group sessions. So if we get them, we would do that. But outside of that, like I said, we're hoping that the skills they learn, they can work with people one-on-one as well.
Okay, great. And Christine Noble just wanted to say a very informative presentation, very educational. Thank you.
Thank you.
I do have a question. You talked about a lot of outreach and dissemination of information. We know that you do that at the hospital, but what other locations do you mostly, and partners do you use to do that?
So we, one of the perks of being embedded within the hospital is that we have access to the hospital's marketing team. So they scour all of the events in our area. We will have a table at, like I mentioned, the Blueberry Festival, the School Health Fair, the Grahamsville Fair. There's a bagel festival in Monticello, which I just found out about and am very excited about.
How do I not know this?
Yeah. And then also we do try over the summer to be present just at random places in the community. Really, we will set up outside of ShopRite or Stewart's and just be available to hand out information. So we really just try to be as present as we can.
Great, thank you. You have another question from Marge Gagnon. Do you have facilitators that offer the 6-session chronic disease? I forgot what it stands for.
Self-management, chronic disease self-management program. So a couple of our community health workers who have been here for a while did get trained in CDSMP. but it ended up not being a very well attended course. So we haven't hosted one in a while. And some of our newer community health workers haven't been trained to facilitate those.
Okay. Any other questions from anyone? Well, I thank you so much for sharing everything. Stacy does have a question.
Yes, I heard you say that for the low dose, I think it was a cancer screening, you had to be a smoker. Could you also have a health like exposure to radon and qualify for that cancer screening?
I don't believe so. So that is a newer, not a newer screening, but it's a screening that has newly been approved by CMS. So they have set the guidelines, and those are what we're trying to go for, because that's the population we work with. We want to make sure that they're going to be able to have it covered if they are eligible. And as far as we've been able to find, there's an age limit. I think it's 45. Anybody 45, and then they have to have smoked for a total of 20 pack years. So that's 1 pack a day for 20 years or 2 packs a day for 10 years, building down from there. What we've been able to find so far hasn't given us much direction past that. We've tried to look into whether you become eligible if you use other tobacco types. We've tried to look in, what does a cigar mean for a pack of cigarettes? If you smoke 2 cigars, is that a pack a day? And CMS hasn't really given super clear guidance in that direction yet.
And Christine has asked for a copy of the presentation, and yes, these will be posted on our website afterwards. So, and I'll send these out, the link out after the meeting. It'll be about a week. Okay. Thank you so much. That was really great. I'm going to share my screen again, and we're going to move on into the next presentation. Our next presentation is actually going to be on family nutrition, fostering agency and empowerment with a systems lens. We have Mary Brimmer, MSW, who's an EFNEP nutrition educator at Cornell Cooperative Extension of Ulster County. I'm going to stop sharing my screen and let her share hers.
Hi, everyone. Thanks for coming today. Just going to go ahead and share my screen. Let's see. For some reason, the tab is not coming up. 1 second. Let me try that one more time. It always works in the trial run, right?
Yeah, we run it. We always practice making sure everybody's presentation works, but there's always a bump in the road at some point.
Here we go.
Perfect.
All right. Thank you for joining me. So today I just wanted to talk a little bit about the program that I am a nutrition educator for here in Ulster County. And then I also wanted to talk about my approach to the program. So I'm coming new into this role, fresh out of grad school and new to the Hudson Valley. And I wanted to share kind of some tools that you also can use in your work, not only related to food and nutrition. So who am I? I've got this cute little image here, but you can see me up on the screen as well. I am the EFNEP nutrition educator at Cornell Cooperative Extension of Ulster County. So I only work with families within Ulster County. I'm also a Healthy Communities team member. So we do other nutrition programming here at Cornell Cooperative Extension, including SNAP Ed. I see our SNAP Ed educator, Josephine, here on the call as well. Thanks for coming, Joe. So my background is in social work. Particularly, I studied macro level social work, but I also have those clinical skills as well. So I try to bring that to this community work that I'm doing through the program. I used to work at a farm store, then I hopped into working with Cornell Cooperative Extension up in Warren County, and then I went to Capital Roots, and I really tried to work my way into nutrition from working in sociology and social work. So that's kind of the lens that I'm coming to this with. So what is EFNEP? We also call it the EFNEP Family Wellness Program here because the acronym is kind of long. It stands for the Expanded Food and Nutrition Education Program. This is a federal program. It's actually been around for about 50 years, but it tends to be lesser known. So I'm hoping that as you learn about it today, you can share it with some others in the community and in other counties as well. So it's offered all throughout New York State and in other states too. So I offer nutrition education workshop series all throughout Ulster County, particularly for families who are SNAP or WIC eligible. And these series, they tend to be 6 to 10 weeks long, and they meet an hour per week. If families attend at least 6 of them, they graduate the program, they receive a certificate of completion, a cookbook, and maybe a prize or a goodie bag from me with some helpful cooking tools. Like I said, it's federally funded, but it's based in Cornell extensions all throughout the state. So here I have a map of all the locations that have EFNEP as a program. So if you know of someone in another county who might benefit from the program, I can always connect you with another educator in that county as well. So who does EFNEP reach? So we have our overhead population of SNAP or WIC eligible households. It needs to be an adult who is raising a child under 18 and responsible for food decisions, who is also that income qualified. So they have to be meeting both criteria in order to participate in the program. If someone doesn't meet that criteria, they can still come along and participate, or I might send them over to our SNAP Ed educator who can work with some differing populations as well. And she can offer 1 to 6 time sessions, whereas I do 6 to 10 weeks. I also work with young adults who are 18 to 25, financially independent, preparing food for themselves. So this could be college-age students, someone living on their own for the first time, maybe someone in a youth program who's living on their own, who is working towards their GED, or maybe they are recently pregnant or recently had a child and need some support around cooking and nutrition and wellness. I also work with youth groups, so I go into some of the school districts, some after-school programs, and that's anywhere from 3rd to 12th grade, particularly in districts who participate in the free or reduced school lunch program at 50% or more, so that usually covers Kingston City School District and Ellen Central School District as well, Ellenville Central School District. So how? So this program is really expanded and evolved to be more adaptable for families. So it's offered through a variety of different modalities. So I can meet with families online through Zoom. I can meet them in person one-on-one, or I can meet them in groups. We can do any of those formats really to fit their schedule and their family's needs, meeting an hour a week at least, but sometimes our curriculums, they go over. We're having a lot of fun preparing food, we're doing some physical activity, there's questions, things pop up, so they can go a little bit longer, but oftentimes an hour. I try to aim for an hour just because they're families, they have other things going on in their lives as well. I reach out to families in a variety of different ways. So through tabling, through partnerships, like I have with many of you here on this call, really trying to use our connections and local resources to work with one another to best meet family needs. Word of mouth, social media as well. So I've been joining a lot of different Facebook groups for different communities within the county to try to see how best to connect with families. But I'm always very open for recommendations on how better to reach families because they've got a lot going on. There's so many different programs and events offered in Ulster County, in Kingston, and Ellenville, all around. So really just trying to network with all of you and find the best way to let families know that I'm here. So what is taught? We have a lot of different curriculum, but at the core of each of these curriculum, I talk about meal planning, budgeting, the My Plate food groups. Everything is based on the dietary guidelines for Americans or the physical activity guidelines for Americans. We also try to promote reducing sugar, salt, and fat intake, talk about food safety and storage, food preparation. With the youth, a lot of the content is similar, but it's more adapted to their level of learning and understanding. So how it's taught. These are some different curriculums that I have, just a few of them that I have within my toolbox to work with families, depending on the topic of interest to them. So each of these curriculums is adapted in a different way to meet their interests. So for instance, Healthy Sense focuses a lot on budgeting and meal planning and the financial aspect of things, whereas Eating Smart, Being Active follows a different food group every single week. And we're really able to dive into that food group and how that family or that child even interacts with that food group, and what can we do with that family to, ensure that it's a part of their diet, and why is it important, and what do they like, what don't they like, and how can we really bolster their ability in health. With youth, the curriculum is age dependent. So there's one specifically for teenagers, and then there's another, Choose Health, Food, Fun, and Fitness, for 3rd through 9th grade. And these don't go specifically through each of the food groups, but have a different topic each week. So recently I just talked to a 4th grade class about reducing their sugar intake, their sugary beverages. I've also talked to them about the different food groups as well, but really trying to focus on the level that they're at, giving them the skills to read a nutrition facts label, and thinking about what access they have and what ability they have as a child within a household. So each of our curriculum also use what we call the 4 A's. So anchoring it in something that they know and have experienced already. Then adding more information, checking in with them about what they know, and building on it. Then they are able to apply it through a hands-on activity, engaging with one another and learning with one another and with myself. And then taking something away and setting a goal for themselves, and every week coming in and being prompted, were you able to work towards that goal? What goals do you have moving forward, and how can I support you in that? So this is our general structure for working with adults or young adults and working with youth. So every week, it tends to follow this structure. We do have entry paperwork and exit paperwork. This helps me assess the needs of the family. It also helps with our program funding. This is questions for adults specifically around their financial circumstances and what community resources they're currently utilizing. It also assesses their current dietary habits. So how often are they having dairy, low-fat dairy sources? How often are they having sugary beverages? Do they wash their hands or wash their produce? And so that getting that at the beginning, I'm able to take that information and really work with them throughout the series and building their knowledge and connecting them to resources as well. So in each class, we start with assessing their experience of something. So if we're talking about grains for that day, what grains does your family like to eat? What don't you like to eat? And then checking in on those goals if they set any for themselves related to the prior content, adding to their knowledge. So beyond just talking about grains, let's talk about the difference between refined and whole grains. Then engaging in some hands-on learning, so visually looking at those different grains, sharing experiences around food. So recently in a class, we talked about how can you make your own crackers from grains. Food activities, so every week people get to be involved in preparing food or tasting food, or they can watch me do a demonstration. It's most fun when we get to prepare together, but being exposed to new things, talking about ways that their family would adapt a recipe as well. So all of our recipes are in line with the My Plate model and the dietary guidelines for Americans. Sometimes they aren't particularly a way that a family prepares them, so we're able to talk about ways that they could adjust meals to fit the My Plate model, or we could adjust recipes to add more flavor and seasonings into it as well. So then moving into goal setting, connecting with any resources, and then at the end, we also have exit paperwork. Beyond that, working with adults, we also do what is called a 24-hour food recall. So this is where I ask them everything that they've had to eat within the past 24 hours, down to any kind of seasonings they put in their soup, any kind of condiments they put on their sandwich, really trying to get a sense of what they had, what was it like, and how much of it did they have. And from that, we're able to generate a report to show them what food groups could they be working on, and what are they doing well in, what nutrients should they focus on. And these are all general recommendations as well. So if they have any specific questions related to their health, I would direct them to a nutritionist or their doctor. And this framework also is very similar to what I do with the youth as well, except they have a different survey where it's just asking about their dietary habits. So what I've found so far within my position, I've been here starting last June. And I really started working with families back in August. And so I've had the opportunity to work with a lot of different youth, going into some classrooms and a few different families as well, and working with a couple one-on-ones with college students. And what I found thus far is we have a ton of resources here in Ulster County. I'm really trying to wrap my head around all of them, and always find myself running into new ones, and wanting families to know about those resources as well, wishing that there were a streamlined approach to getting all that information to them. Also, I found that families have a lot of skills and knowledge already that they're coming in with. There's a lot of culture and diversity here in Kingston and in Ulster County. A lot of things that I don't know about, a lot of things that I really would like to learn about. So leaving that space in my classes to learning myself and not coming in with such kind of an expert lens. Also, giving room for people to share their lived experience around food. So everyone has different associations with food, good and bad, and it's such a part of our day-to-day life and very personal. And so going into it with kind of some sensitivity as well, and really trying to think, what can I contribute and support this person with, and what can they share with me in order for me to further develop the program too. And there's a lot of social support too, especially in these group settings. Parents have a lot to share with one another, especially around picky eating, different brands that they like to buy, different stores that they should go to, or recommendations on who to talk to get a better deal on something. Some of the challenges for families, though, are time, providing childcare. So in order to attend a series, they might need to be away from their child or their family, or find someone to watch their children. Accessibility, so language goes along with that, where I don't speak Spanish, so trying to find avenues to bring this information to Spanish speaking families or families in the county who speak other languages. Transportation, so trying to meet that barrier using online formatting, addressing stigma too, and I'll get into that a little bit more. But I think oftentimes when people hear nutrition education, they anticipate coming in and having me tell them what they're doing wrong, right? They think they're going to come and I'm going to tell them, you need to eat more vegetables, you need to stop having sugar, but really trying to reframe that and give them tools and power over their choices, making informed decisions. Also confusion about, what the program is, or mistrust coming in and into a new program. A lot of families have worked with a lot of different community resources and providers. And over time, I think that starts to create positive and negative experiences around working with them. So in interacting with the community, I've found a couple different perspectives that I often run into. One is associating poor nutrition with individual will or self-control. So I have people come up to me and they say, thank goodness you're doing this. I see all these people, they're making bad decisions. Why don't they just buy organic local food? And yes, that's the ideal. That also comes from a place of being able to access those things and privilege. And I want people to know that, yes, like they do have the control and the ability to make choice. But at the other end of things, I do experience people coming in and saying, what can I even eat? Everything is affected. Everything has preservatives, everything's too expensive. I'm just going to eat whatever is in front of me and what tastes good. Right. So and these are all normal experiences, right? We all want to enjoy our food and have control and ability. But at the same time, we're faced by limitations in access and monetary ability as well. So through my lessons, I really try to find somewhere in the middle where they can acknowledge that they have individual control over some aspects of their diet, while they might be facing some limitations within whatever system they're in. So financial limitations or their community context and what they're able to access there. So going into a bit more about, just checking the time, my approach to nutrition education, I try to come in with some of these aspects of social work that I've learned so much about. So meeting each family where they are in their experience around food, and not coming in, like I said before, with this mindset of, I know everything, this is what your family needs to do. But instead talking to them, what do you want to learn? And what are you doing well with? What do you need some support with? And using that as our basis of where to go. The curriculum is set in what we talk about, but there is a lot of room for conversation and growth for the family or individual throughout each lesson as well. So giving that space for conversation and sharing, spontaneity too. So a lot of people might come into a different topic during our lesson, and they might have questions right on the spot then and there. And so sometimes it involves transitioning to focus on that topic a little bit and hearing what everyone in the group has to say. Also trying to normalize things and empathize with every individual. So as families share with one another, they're able to really see like, oh, another family experiences that too, or they've had that same interaction with this type of food. How can we be there for one another through these weeks? I call this strategic self-disclosure. So talking about my own experiences around food too, being transparent, that I struggle with different food groups too, and that these are kind of goals and frameworks that we can use as tools to inform our decisions every single day. Our diets are going to vary day to day, but what can we do each day to set a small goal for ourselves? Also increasing opportunities for decision making. So really trying to get them to see where they have control within their framework, and using a person and environment perspective and systems thinking. So I'll go into that model a little bit that I use. So thinking both about individual factors, but also thinking larger to the systems that this individual child or parent is within, or both together. So related to nutrition, there are a lot of different aspects, right? So we come in, we're different ages, different genetic makeups, different levels of exercise, or our bodies are digesting things differently. We might have different metabolisms, right? So every body is going to be unique coming into the program. And also your thoughts, your feelings, and your experiences around food are all going to be unique as well. So acknowledging people are going to come in with different values and priorities, different goals and expectations, and making sure that the space feels comfortable and empowering for everyone who's there. Not talking about food in a shaming way, not talking about it in a negative way, but in a way of focusing on the benefits of it and how nutritious it can be for each of us. Also, our social context. So this is where I move into the larger kind of systems picture. Who we interact with in the spaces around us influence how we feel about food in our body and what we put into our body as well. So we hear a lot of mixed messages from the media around what to eat and what is the best thing for us to eat. And it can be very confusing to know how to navigate things. And at the end of the day, sometimes families are like, I'm hearing so many different messages. I'm just going to do whatever I want, right? And trying to come back down from that and think, okay, but each of you have your own, each person has their own agency over what they get to feel and think around food and what they can put into their bodies, and trying to help them see that what they what they get to decide each day is really on them, right? And so also moving into this larger kind of systems theory, Yuri Bronfenbrenner, he developed this theory of child development. And this is usually what I'm often thinking about when I'm interacting with families. So I go in first and foremost, and I ask all these questions about who are you connected to? What resources do you have? And over time, I get to know other aspects of their system too. So I learn more about their culture. I learn more about their community, and try and think of which of those aspects in their system are negative influences or positive influences, and what are they not connected to already that we can throw in to build that system so that they can feel like they have others to go to, that they can feel like they have other resources as well. So I've also started to notice that in working with families, not only am I coming in with a systems perspective, but I'm trying to foster it in them as well. And there's this great resource online that has some little flashcards about what it really means to be a systems thinker. So I'm just going to stop sharing so that I can share these cards too. Sorry about that. Please stand by.
We're good. Take your time finding it.
Okay. So this is called the Thinking Tool Studio. You can actually buy these cards, and each one flips over. So seeking the family to help understand the bigger picture. And it explains what that is as well, and some questions to ask yourself when you're thinking, when you're working with that family. So how can I help this family see their connection to the bigger picture around nutrition, and not focus so much on their individual context, but also what else is out there for them? Observing how elements within the system change over time. So how, thinking back to their own family, for instance, and how nutrition has evolved within their family and things that are passed down within their family. What patterns do they have around food? What habits do they have around food? Changing their perspective, so being open to hearing from one another within our group context. Cause and effect relationships as well. So how is this food that I'm putting into my body going to make me feel? What kind of energy am I getting after having it? And what effects does it have in the short term and long term on my health? Different mental models. So thinking about how someone might have a different experience around food, and their mental model around food might be different than my mental model around food. And really considering something fully. So encouraging them to really think about the information that is given to them when they're reading about nutrition or they're hearing about different bad diets or different messages that they're receiving. Starting to understand the systems to figure out who that they can connect to, what resources are there, helping me understand the system. And understanding how our systems affect our behavior too. So who are the influences around us and the day-to-day places and contexts that we interact with, and how do they influence how we're approaching food and nutrition. Like I said before, considering long-term and short-term effects, and then this goal setting. So slowly over time, seeing how these subtle changes that and goals that they're setting for themselves are affecting their feeling in their body and their health. So as you can see, there's a lot of different cards here, a lot of great questions, and the link will be in the presentation too for each of you to take a look at and really think about, how does systems thinking relate to your experience in your work around nutrition, or your experience within your role with the community. So I will put my information in the chat. I do have a lot of upcoming series for families within Ulster County. One of them is online. Some of them are parent and child workshop series, and some of them are groups, including a breastfeeding group. So I will be sending out information using our Google group as well, but you're welcome to reach out to me if you are interested or if you know anyone who may be interested.
Great, thank you very much. We do have some comments in the chat. Sue Lennon said, this is a great program. I hope you get a lot of participation. Ninette Warner, these cards are great. Love the examples of questions to ask. Maria Reidelbach, they are great. Love these. And Shara Dassey, excellent presentation, Mary. Does anyone have questions about the presentation or any information? Yes, Maria.
Mary, that was terrific. Thank you. You're just so thoughtful and deeply kind to be addressing your clients this way. I really learned a lot from hearing about how you approach this. One of the things that I've struggled with a little bit when talking about the kind of chronic diseases that are caused by a bad diet is using the word fat. It seems like fat is it like not a word you can say anymore? I mean, certainly you don't want to fat shame people. And I've noticed even in articles that talk about that, they don't talk about the addictive nature of processed food, that's designed to, make you want more. And it really does remove human agency.